All right. Hello, everyone. Thanks for joining. We've got Jenice Mattek. A little bit about her. Jenice is the Director of Fitness Education Seminars, as well as Chicago Integrative Movement Specialist. Jenice oversees and organizes the seminars, product sales, and marketing for fitness education seminars. Jenice has developed seminars for massage therapists in the area of fascial techniques, scar tissue therapy, and client education strategies. Jenice is Dr. Osar's teaching assistant and wife at conferences and for the Integrative Movement Specialist certification. And on a personal note, I have completed their ICEI course, as well as I'm going through the Integrative Movement Specialist program this year. So on a personal note, Jenice is awesome and their programs are all phenomenal and I would highly recommend. So let's get started and hear what Jenice has for us today.
Awesome. Thank you. Ooh, what was that? Hello. Somebody in there? All right, cool. Awesome. Hello, everyone. Thank you so much for jumping on. We are at 72 participants. So Holly, when you jumped on, we were only at like 17. So you are right. More people are coming on because this is great information. And I will tell you, so before I go into my story, and we actually go into this, last week I wrote a newsletter for our clients and patients, and we've probably spent more time writing newsletters during COVID just because we don't get to see them as much. And so we want to make sure that we're still inspiring them and still giving them great information. And I took over the last few newsletters and I wrote about doing this talk today. And in the talk, I said, I'm actually a little nervous and I have a little anxiety, not because I'm nervous about presenting this information. I do this all over the world. That's not the problem. I was concerned because the title says breath in it, right? And so many people are going to think it's mundane sounding. We all breathe, right? And lots of people who come through our course like, my clients don't want to do their breathing. They don't understand. And I said to my clients in the newsletter, I said, I don't want it to be or sound mundane. I don't want people to bypass it because it says breath in it, because it's their stories. Their stories help us create this work. Their stories of success and life changes. And I'm going to share their stories with you, but it's also my story. It's my story of how this has changed my life. And so with that, let's get started. So the topic, which I want to be in full transparency, if you've ever met my husband or you've seen him speak, he likes to do things for me, like create titles that I'm going to talk about. And so he chose this title, which when I saw it again, gave me a little anxiety because it's a bold title. But I lived up to it. I feel confident that I lived up to it. So breath, the secret to dramatically improving posture, movement, and performance. And I love this quote, change your breathing, change your life. Because when you can do this, remember, breath is life. If we're not breathing, we're not living. And so the quality of your breath will directly affect the quality of your life. So I'm super excited to share this with you. Let's grab my little thing here. All right. Hey, Evan. Never mind. Okay, so why am I presenting this information? Because some of you probably have no idea who I am. I see familiar faces, but there's a lot of people on here, and I know I don't know everybody. So this was a year ago at FAI. Dr. Osar and I were presenting a pre-conference, and Evan asked me to teach the assessment portion as well as the breathing portion. This is me right here, and this little lady here. She was in the front row of our session, and we were doing an assessment that we're going to do later. And one of them was bringing your arms up overhead. And she sat there, she raised that one arm, not a problem. And the other arm was more like this. She was trying so hard to lift it up. And so we went through our breathing, and after the end of it, both arms just floated up. We did about 10 breaths, and almost both arms almost equally floated up the same distance. And we were both in this picture crying our eyes out because it was such an amazing thing. She couldn't believe that that little exercise could do that much for her. And this is Heidi. Heidi came up to me the next day and she said, there was so much going on afterwards. I didn't want to tell you this, but she had fractured, I believe had fractured a couple of her cervical vertebrae and been in pain for years. And after that exercise, she didn't have pain. A few breaths could change that quickly. So when that happened, of course, I had to post it on social media because it was all amazing. And Dan came up to me, he's like, Jenice, what happened in that session? So I was talking to him and he said, do you think next year you could just do a whole session on breathing? Me, a whole session on breathing? Absolutely, I'm gonna do a session on breathing. So that's why I'm here today. And I hope you guys can hear this. I'm gonna see if this works. Okay. If this is too loud when I play it, I apologize.
The TPC, because I think that now the breathing is going to be easier on the client. They don't have
applying the breathing techniques to improve efficiency.
Aha moment this weekend was really how little it takes to see the changes with a lot of just the breathing. So the breathing.
Awesome. It's really one of the first things that I bring back is the breathing and having more purposeful breathing with purposeful movement on pulsars. Yeah, that's great.
So these are testimonials after our 3-day course that Amanda told you guys she's already been a part of. And we asked people, what were your big takeaways after this weekend? And this is more than 50% of the people in the room, and each one of them, the breath work or how we were teaching them how to do breathing and what they felt and the differences they saw in their own self-assessments and assessments of their classmates, they understand the importance of teaching breathing. Okay, so what are the goals of our session today? I want you to feel how you too can harness the power of optimal breathing. I want you to be able to implement 3-dimensional breathing into your sessions. And then I want you to know how to confidently educate your clients on the importance of doing 3-dimensional breathing. So, are there many different types of ways that we can teach clients how to breathe? Absolutely. From the dawn of time, people have been teaching and learning the benefits of breathing. What's the best way to do it? I'm going to share a really great book with you that's really popular right now. It was sent to me by a bunch of people to read it. And honestly, I signed up for it and I was on the, waiting for it to come out on my Kindle and I totally forgot. And another person said, hey, Jenice, I think you're really gonna like this book. And so I started reading it. It's a super easy read. And he lists all these different types of breathing that he actually went through, practiced, learned about. So yes, there's many different types of breathing that you can learn for many different purposes. All right, so what are the basic benefits of breathing? And these are just some of them. But we know it creates oxygenation. We need gas exchange to happen when we do breathing. It creates improved energy. There's this really cool site for teaching kids about respiration. And they show the example of a candle that's lit and then covering the candle and the fire going out. And how we need oxygen for energy. If we take away oxygen, we take away our energy. And it's just a really cool, clear example of why we need to breathe and oxygenate. It also creates relaxation through the central nervous system. It helps with mobility and it also helps with stability. And we are movement and exercise specialists, so this is the area that we're gonna focus on today when we're talking about the power of 3-dimensional breathing. Okay, so what does it look like when your client doesn't breathe well? What are they gonna show you? What are they gonna tell you? So you're gonna have those clients who have those barrel chests, right? Those really wide, broad chests and rib cages. And part of that's gonna be due to the fact that they're not exhaling fully. So if you do this, if you take an inhale in, and you're not a real deep inhaler, right? If you inhale and you don't fully exhale, and you keep inhaling and you don't fully exhale, you're gonna try to create space to get that breath in. So they're gonna have that barrel chest. You might also see clients who have those really wide, splayed rib cages, right? Your rib cage shouldn't be wide open at the bottom. So you're gonna see clients who have that. That's another example that they're not a great breather. They're gonna have that extended or forward head carriage. Again, a sign that somebody's not a great breather. They might be hyperkyphotic. If I'm all bent over, I'm not able to expand my breath. Thoracolumbar extension. If I stand up tall like this all the time, or most of the time, I'm not gonna be able to get that 3-dimensional breath. Your forward shoulders, your clients who are here, if you're rolling forward this much, again, you're not going to be able to expand your rib cage like you needed to get a 3-dimensional breath. And one thing that they'll tell you is, I'm always tight. I'm always tight. I always feel tight. I always feel like I just want to stretch. It's like I just want to stretch something. These are all signs that they're not breathing well. I will give you the name of the book at the end. I see somebody ask that. All right, so what changes? As children, as we naturally grow, as babies, our body just naturally learns how to breathe like it should, barring any kind of injury or congenital disorder. So what happens to us? Well, trauma. Trauma can be physical, mental, emotional. If you broke a rib, it's gonna change how you breathe. If you ever even bruised a rib or had somebody punch you, you know that's hard just to expand because there's pain, so you're not gonna wanna breathe into that area. If you've ever had somebody tell you something, what is the first thing that happens to you? When they tell you something that you don't like, you don't hear, it's shocking, it makes you scared, it makes you sad, it hurts you, it takes your breath away. And oftentimes there's a lot of research around this, it will actually show you that you actually hold that breath. You actually start to hold your breath as a fear response. So trauma is one thing that will change how we breathe. Surgery. Anesthesia alone will change how we're able to expand and breathe. Just right after your surgery. And then as you compensate after a surgery, that too will start to change how you breathe. Our habits. This is probably the one that we see the most with our clients, barring surgery, because that's actually one of the areas I specialize in, is working with women post-surgery, abdominal, pelvic, breast, and chest surgeries. But habits are a big one. I have a woman, Joanne, she's in my list of clients I want to tell you about. When Joanne came in, she actually came in post-surgery. But one of the things Joanne told me is she's a ferocious reader. She's always been a ferocious reader. But when she reads, her breathing looks like this. That's how she breathes for hours at a time, because that's what she does when she reads, and she reads every day. So her habit of breathing had become these very short, shallow breaths. Habits. How we exercise will change how we breathe. If we think of some of those common postures, if you think of your clients, people who do spin class a lot. Evan has this amazing picture of this woman down on her spin bike, and she's just like this on her spin bike. You look at a lot of bikers, how they sit on their spin bikes. They're in a lot of cervical extension, so they're not gonna be able to breathe well. Habits are gonna change how we breathe, and I'm gonna show you more of that. And then illness. If you have clients who have emphysema, COPD, any kind of illness that can affect their respiratory system or their cardiac system is likely going to change. Think of your clients who have asthma, or your kids who have asthma, even allergies. You can't breathe well. That's the number one thing people say. I just can't breathe, it's my allergies. I'm swollen, I'm puffy, I can't breathe. So all of those are going to change how you breathe. So why is breathing important to me? I don't know if you can see these. I have never shared any of these pictures before. So this is me at Christmas time. I think in this picture, judging by the glasses I am wearing in that picture, I'm about first or second grade, probably second grade. I think they're the rainbow speckled glasses. And from the earliest age that I can remember, my mother told me, you need to stand up straight. You need to pull your shoulders back. You need to pull in your belly button, and you need to squeeze your cheeks. And she wasn't meaning these. She was meaning the ones I sat on. And as Evan, my husband, will tell you, I am an excellent rule follower. And I followed those instructions to a T. I lived my life pulling my shoulders up and back, squeezing my abs in, and pulling in my glutes. Around this same age, my parents came into my room one night and I was turning blue and I wasn't breathing. They took me to the hospital. They put all these wires on my head, and there was nothing wrong. They couldn't find anything wrong with my brain that would say why I had stopped breathing while I was sleeping. Around this same time as well, I was diagnosed with migraine headaches. I was 5 years old. I was on the couch. I was crying. My mom's like, "What's wrong with you?" I said, "I have a headache. My head hurts." I didn't even know it was a headache. I'm like, "My head hurts." And she's like, "You're too young. You can't have a headache." And so she let it go, but it kept happening over and over and over again. Finally, they took me to the doctor, and the doctor's like, "She has migraine headaches. You need to avoid hot dogs, processed food, chocolate, cheese." I grew up in Wisconsin. Avoiding cheese was not going to be an option in the 80s. So life went on as normal. The other thing the doctor said is, here's a small pill. She can put this underneath her tongue as she feels a headache coming on. I'm 5 years old. I don't know when a headache is coming on. It was just pain at a certain point in time. And so I went through life like that. I think back then my mom was giving me aspirin. This is before ibuprofen really became something that people took a lot of. And then here I am. It's kind of a grainy picture because it's a copy of a picture at my high school graduation party. By this point, my hormones had kicked in to high gear, and I was having migraine headaches on a regular basis. Progress a couple of years further into my 20s, I was taking up to 1,200 milligrams of ibuprofen a day. The headaches were so bad, I felt like somebody was stabbing me in the eye with an ice pick. Fast forward a little bit further, I moved to Chicago, and I met this guy. You may recognize him, Dr. Evan Osar. I asked him which picture he wanted. I'm like, can we do the picture where we're like hanging out in the park and I got this really cool shirt on, or do you want the one with the bow tie? And he was like, the one with the bow tie. So I met Evan when I was about 26 years old, and we started working together shortly after I got done with school. And one of the things we had realized as we were looking at my posture and what was going on with me was that I had completely reversed the curves in my spine from the posture I had adopted at a young age. Not only did I adopt that posture, but I was in gymnastics, which further emphasized that posture. Then I started to lift weights when I was playing sports, which now you're in that same posture, being cued in that same posture now against resistance. So everything I did was that posture dominating my life. What we also noticed, and many of my trainers that I worked with at the time would say, Jenice, you need to breathe. And I would say, I am. And they're like, no, 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 you need to breathe. I'm like, if you can't see me breathing, that is your problem. I am breathing. And that went on. And so then we started to look more at breathing. So I had reversed the curves of my spine. And then we were like, Jenice, you're not really breathing. Everybody's telling me you're not breathing well, you're not breathing big, you're just not breathing, you're getting a full breath in. And so we're looking at breathing. We started using breathing. So I'm about 26 or 27 at this point. And within 18 months of changing some of the habits that I had created with my posture, with my exercise, with my movement, and changing how I was breathing, consistency, in about 18 months, I was no longer taking any medication. I'm 46 now, so it's been almost 20 years and I've taken no pain medicine for a headache. Do I never have a headache? No. Is the intensity way less if I do? Yes. Can I count the number of headaches on one finger I have a month? Yes. And if I have a headache, I will tell you 98% of the time it is self-induced. One, because we're all guilty of not taking care of ourselves, self-care. If I don't practice what I know I need to do to stay away from a headache, I will have a headache. Generally around the time of my period, it can be very hormonal. I will also have a headache. Evan and I travel a ton. If I don't pay attention, just exhaustion, I will have a headache. I will also have a headache, full transparency, if I drink too much wine and not enough water. So those are the reasons that I will have a headache today. But to say that I'm now 46, 20 years later, and I have no headaches, I have no shoulder tightness, I have no neck tightness, no neck pain, that was actually starting to scare me because my career as a massage therapist, which I was only a year into at the age of 26, was quickly dwindling in front of me because I couldn't even lift my arms up over my head. So that's why this information is so important to me. So there are two primary muscles of respiration. Now you can argue there's more, but for our purposes today, we're gonna focus on the intercostals, those muscles that run between each set of ribs, and our diaphragm muscle. So this is the diaphragm, just to kind of give you an orientation. The diaphragm in this picture is actually peeled up and back a little bit, right? So the diaphragm is this dome-shaped muscle that sits inside of our rib cage. Important things to know about the diaphragm as it relates to what we're gonna do today. It attaches to our lumbar spine. It attaches to our ribs. Sits, like I said, it's a three-dimensional muscle all here. So it's a dome-shaped three-dimensional muscle. Our intercostals here, now there's three different sets of intercostals. We're gonna talk about them as a group, okay? When we breathe, the intercostals actually work to open and create space between our ribs. The diaphragm, when it contracts, it actually sits in a dome position. As it contracts, it lowers down, okay? So we have the intercostals between each of our ribs, and then we have the diaphragm. Now, those are the primary muscles, so there's actually gonna be accessory muscles as well. We have muscles, accessory muscles that help with inspiration, more think of forced inspiration and forced expiration. So really quickly, if you wanna do this with me, we have the sternocleidomastoid muscle, just as the name suggests. It comes from our mastoid process. There's two heads that come down here, and they attach into our clavicle and into the top of our sternum. The sternocleidomastoid, wow, that's a mouthful. Sternocleidomastoid muscle, all right? We also have the scalene muscles. They're small little muscles. There's three of them, anterior, medial, and posterior. Those guys sit here. They go from our transverse processes of our cervical spine into our ribs. We have the pec minor muscle. Everybody's familiar with that one. It comes off of our scapula and inserts like fingers onto our ribs. The serratus anterior. If this hand is my scapula and this hand is my serratus anterior, it sits on the front of our scapula and wraps around like fingers to attach onto our rib cage. We have the serratus posterior superior. Not a lot of people talk about that one. The serratus posterior superior actually sits underneath our rhomboids and runs in almost the same direction, just has a few different insertion points on the spine, but attaches to the ribs. The iliocostalis cervicis, another one not a lot of people talk about. This one is a small muscle, again, from our TVPs onto our upper ribs of our cervical spine. The force muscles, or accessory muscles of breathing for expiration, we have our rectus abdominis, everyone knows that one. From our xiphoid process to our pubic bone. We have our internal and external obliques. When we have forced exhalation, they compress the ribs down closer to our iliac crest. The iliocostalis, the lower fibers, when we breathe, they actually help. They actually will lift our chest up if we're doing forced exhalation. Longissimus, the same idea. Serratus posterior inferior. If you have a superior, you have to have an inferior. Serratus posterior inferior is more down by our lumbar spine, but again, attaching to our ribs from the spine. And then the dreaded QL or quadratus lumborum muscle, which is attached to our lower rib and down into our iliac crest. These guys all help with forced exhalation. The problem is lots of times, most of our clients are using these for regular breathing, or some of them. If you are primarily a chest breather, where do you think what muscles are you gonna use? You're gonna use all these guys here that are attached to your neck and into your ribs. You're gonna start to bring your head down this way because they contract you this way. You breathe up here, you're gonna be breathing like this. So just something to think about. If you are always thinking about expiration, if you're a heavy breather, you're gonna be using a lot of your abdominal muscles as you're doing your breathing. So these guys should help you. If you're doing a lot of cardio, you're gonna feel them. The problem is it's not how you should breathe all of the time. So one other relationship that's really important to breathing is this relationship here, the diaphragm psoas pelvic floor relationship. Here's our diaphragm here. We have the psoas muscle that runs here along the spine, inserting into our hip. Can you guys see that okay? And then we have the pelvic floor muscles, which we're just gonna talk about them as a group. When we breathe, the diaphragm and the pelvic floor work together. So my diaphragm is up here, it's shaped like a dome. My pelvic floor at rest, those muscles are shaped like a dome. When I inhale, the diaphragm concentrically contracts to lower, and then my pelvic floor eccentrically contracts to carry the weight of the organs as my diaphragm is pushing on them. As I exhale, the opposite happens. My diaphragm eccentrically relaxes and my pelvic floor concentrically contracts. Please don't confuse that with a Kegels exercise because that's not what this is. This is the natural course of what happens when we're breathing correctly. Now, how is this psoas involved with this? The coolest thing is when you get to go to a cadaver lab and you see all this, this is when we really learn this, which is super cool. So when the diaphragm, you can see it's got these attachments onto the spine. Well, these fibers come together and they kind of look like this. They blend together. The diaphragm blends together with the psoas, and then the psoas, before it inserts onto our femur, actually fascially blends with an attachment to the pelvic floor. That's kind of exciting. I can't see all your faces, so I hope you're excited as I am about that. But, so it's like a communication system between these two sections. Okay, so how do we help our clients breathe better? This is from the integrative movement system. We need to create breathing efficiency so we're not wasting time and energy on breathing so we can get the best performance. Now, performance to each of your clients is a different thing. It's a personal thing, right? If I need to perform my ADLs to stay in my home, that's my level of performance that I need to do. If I need to run a marathon, that's my level of performance. Each of your clients comes with a different story and a different set of goals. So performance is different to everyone. We must create the best alignment for our clients so that they can get the breath in and get the breath down where it needs to go. So if my client is sitting like this all day long, or if I put him on the floor and he's still like this, he doesn't have a really good chance of getting that breath in through his nose and efficiently down to where it needs to go. So my job is to put him in the best alignment so that the air can get to where it wants to go in the most efficient manner possible. So he's just using those two muscles and not all those muscles to get the breath there. I must teach him how to breathe. Excuse me one second. I needed to find this quote, and it comes from the book that I will give you the title to shortly. But there's a gentleman, his last name was Stowe. He was actually a music teacher in the 40s. And I love this quote from him. He said, "I foolishly assumed that everyone had at least a rudimentary knowledge of physiology. Even more foolishly, I assumed that the universal awareness of the importance of breathing existed. Nothing could have been further from the truth." And it's so true. So we need to teach our clients, we need to re-educate them how to breathe. How many of you have to teach your clients how to squat? Almost every session. You need to teach them how to squat again and again and again and again. Well, guess what? They don't squat all day long. However, they do breathe all day long. So you need to teach them how to breathe correctly. It is an exercise. You are using muscles. It is an exercise. So you have to teach them what that means to breathe correctly. And then you need to teach them how to control that, meaning using the right muscles for the task at hand. If I am breathing quietly, I should not feel my lats while I breathe. I should not feel my erectors as I breathe. I should not feel my pec minor firing up every single breath I take. I should not feel tightness forming in my neck with every single breath I take. So we need to help our clients use the right strategy while they're doing exercise, while they're taking a walk, while they're sitting at their desk. We need to help them discover what that looks like. So what is three-dimensional breathing and what does it do? When we're teaching it, it focuses on accessing the entire diaphragm. If you have a client who lifts their chest up all the time, likely they're only accessing the anterior portion of their diaphragm. We need them to access the entire 3 dimensions of that diaphragm. It's about creating space and mobility in the rib cage and thorax. How many of you have clients who their rib cage is so stiff that it moves like a block? Right? How many of you have clients who their back, they always have this like, oh, it's like so like tight, like right up here, like I can't get to it. So breathing is going to help mobilize that. If your client's ribs are stuck together like this, how much movement do you think they're going to have? If you can create that space, then you can help them and give them more mobility. Create stabilization of the spine and trunk via intra-abdominal pressure and that marrying of the diaphragm, the psoas, and the pelvic floor. Helps create stabilization just because of the attachments and that fascial blending that they have together. And then it activates the deep spinal stabilization, deep spinal and hip stabilizers. What does that mean? Along your spine, the diaphragm helps stabilize it. It's attached to it. Your psoas helps stabilize your spine. It's attached at so many levels. Your psoas then goes down and attaches into your hip. And then that pelvic floor, it helps activate those muscles, those small little muscles that stabilize that through those fascial blendings. All right, so in full transparency, I put this here. I did screenshot this video from the internet because it's so important for you to see. This is credit to Stockbridge Osteopathic Practice. This is from their Facebook page. Evan, can you turn that light up a little bit? All right, so orientation. This is a lateral or a side view picture. These are the organs, some of the organs of our abdomen. This black right here is the diaphragm. When we breathe, our organs should drop down. This is what we were talking about. It pushes the organs down, the pelvic floor catches them, and then they come back up. There's this gentle massaging action that happens when we breathe. Our organs do not like to be stagnant. They love to move. Breathing helps with that. If you've had clients who've had abdominal or pelvic surgeries, you need to explain that to them because they will have scar tissue that forms. They will develop bowel obstructions. They will have worse problems. Well, that's a pretty bad problem, but they'll have a lot of problems related to scar tissue that nobody will talk to them about. But if you can show them this is the #1 thing I give my clients, and they don't have bowel obstructions after they start practicing this. I don't talk like that ever, but that one I know. Okay, so this is another great video. Again, full transparency. This is from Think Beyond Pain. This was first put up by Julie Weave, a physical therapist, and then she shared this on her page. So, little orientation here. She's gonna show you first chest breathing. These are the pelvic floor muscles. This is a very full bladder. So in chest breathing, you can see there's not a lot of motion here in the pelvic floor, right? There's not a lot of movement going on. So then she calls it belly breathing. We're not gonna do that. All of a sudden you start to see this movement in the pelvic floor when you change the strategy your client is using for breathing. That's crazy stuff. The fact that people are willing to share this stuff is fantastic. So that's part of the reason we have to teach our clients how to breathe better. Okay, so we're gonna use the integrated movement system because that's how we teach things. Really quickly, there's 3 phases that we're gonna look at. We're gonna look at the discovery phase. You need to know your client's medical history. You have to do assessments with your clients, even if you're having them self-assess, if you do mostly groups. This is how you can get your clients to buy in to what you're teaching them and how it's helping them in each individual session. The address phase. We're gonna release those muscles that are inhibiting your client's ability to actually expand and breathe. But we need to know what those muscles are and where they're not moving. And then we need to activate that deeper system to support their breathing. And then finally, we need to integrate this breathing activity into not just their exercise, but their activities of daily living. It has to be something they do all the time. How many people agree that, how many people tell their clients to drink more water? Yes, right? This is gonna be the next thing you're gonna tell them to do. You need to do your breathing. You need to drink more water, you need to eat your green vegetables, and you need to do your breathing. Okay, so when we talk about taking a medical history, because you need to know, does your client have a problem? Oh, hi, Marcia. Does your client have a problem that's causing them to not be able to breathe well? My dad has COPD and emphysema. Breathing is a struggle for him, but you need to know that your client has that because you might develop a different strategy. You might speak to them differently when you're teaching them breathing. And here's the thing. We check in with every client at every session. Hey, how was your week? They might tell you something they wouldn't have told you had you not asked that question. If you haven't seen a client for a while, you need to ask them what's been going on since the last time you saw them. Did you ever go to, now, my parents have been going to the doctor a lot as they're getting older, which I don't like, but it's reality for them. Do you know that every single time they ask my parents, do you have any new medications? Sometimes my parents go to the doctor like every week. And every week they ask them the same questions. Do you have new medication? So we need to be checking in with our clients. Has there been any changes? Because it may change what we're gonna do with them in that session. So we're gonna do some quick assessments here ourselves. And Dr. Osar has graciously volunteered to be my volunteer for this part of the session. He's gonna turn on our Hollywood lights so you guys can better see. We're gonna check 3 areas that are super important when you're talking about breathing. We're gonna look at cervical rotation. If you remember all those accessory muscles that attach into the cervical spine. We're going to look at shoulder flexion. So many muscles of respiration attach into parts of the shoulder, the scapula, the humors. There's so many. Also, we're gonna look at hip rotation. You might say, Jenice, why hip rotation? There is nothing related to breathing that is attached to my hips. Yes, there is. If you remember, we were talking about that psoas diaphragm connection into the pelvic floor. Do this, okay, you guys, let's stand up. I'm standing up, let's everybody stand up. Let's do this together. I want you to do this with Dr. Osar. Well, before we do that, we're gonna do this on yourselves. Nope, stand up, Marcia, stand up. Okay, I want you to, very quickly, squeeze your glutes. Squeeze them, I know you know how. Squeeze those glutes. Now, keep them squeezed and take a breath in. Okay, do that again, keep them squeezed and take another breath in. I'm checking all of you. I can only see a handful of you. I'm checking everybody. Okay, now I want you to let your glutes relax, shake it out. Good. Now take a breath in. Did it feel easier to breathe when you relaxed your glutes? Can I get a thumbs up if everybody found that? Awesome, thank you so much. Have a seat. I know a lot of you have probably been on your computers for like the last 2 days, 3 days, And I wanted your eyes to take a little rest from being that close to the computers. All right, Dr. Osar, you're up. Oftentimes I'm the one doing this and Dr. Osar is doing all the talking, so this is kind of fun. All right, so there's 3 assessments we're gonna have Dr. Osar do as it relates to looking at his breathing. Dr. Osar, I'm gonna have you turn and face the wall, please. So we're gonna have Dr. Osar do basic just cervical rotation, looking over his left shoulder, his right shoulder, and then, but we're gonna have him look from this angle because this is our guide. How much of his face can I see as he's doing his rotation? Now, he did tell me that he was struggling a little bit with his cervical rotation today. Okay, so which side does it look like Dr. Osar is struggling to get to? Point, give me a point. Yep, his left side. All right, Dr. Osar says thumbs up, absolutely. Okay, Dr. Osar, turn and face us. All right, we're gonna have Dr. Osar do hip rotation. He's gonna place his hands on his hips, and all he's gonna do is turn to his right as far as he can go before his hips stop him, come back to the left, and then rotate to the left. Sorry, come back to center and rotate to the left. Good, and which way does it look like Dr. Osar appears to be struggling with his hip rotation? The left, to the left? Yep, to the left. Would that be true, Dr. Osar? That would be true. He likes to squeeze his butt sometimes. Shh. Okay, turn to the side for us, Dr. Osar. Okay, so Dr. Osar is gonna do shoulder flexion. I'm gonna have him put his right hand over his left rib cage because I want him to feel what happens when he raises his arm up overhead. Now, Dr. Osar, is that as far as you can go? Nope, look it, he's gonna show us what happens if he compensates a little bit. If he lifts his rib cage or extends his rib cage, he's gonna get full range of motion. Do anybody's clients do that? No. All right, so now he's gonna do the same thing on the other side. Which side do you think Dr. Osar is struggling with? Anybody have a guess? Which one do you think it is, Dr. Osar? Does that help you? So it's his left side. So he's struggling with his left side. Okay, great. So those are some quick, easy assessments that you can do with your client. If you do more hands-on work with them, you can do it yourself, or you can just have them do it. And sometimes I think it's almost more value for your client to do it just so they can feel the difference. So that's our quick, easy assessments. Then we need to go in and we need to go into our address phase, which tells us to release the areas that could be impeding breathing. And that list that I gave you is a great place to start, but you can also go by what you see in your client's assessment as well. You should. And then we need to do some 3-dimensional breathing, and then we need to do some activation of the deep system to help support and start to reprogram some of the poor strategies that your clients are using that continue to impede their ability to breathe. So come with me through our studio. This is like Hollywood stuff right here, you guys. I'm not even joking. All right, so remember, if I told you, we started right away. Align, I need to get him in the best alignment for breathing. All right, so Dr. Osar, I'm gonna have you lie on your back, please. Plant your legs flat, please. So what you wanna do is you wanna look when your client is, whoa, let's show Dr. Osar there. Okay, we gotta show him. All right, we need to know, is there an area where Dr. Osar looks to be struggling? And you wanna make sure that your client's in the best position. I don't know if you guys can see this, but he kind of looks like he's got a little bit of a turtleneck going on here. Not like a turtleneck like here, but like a turtle going into a shell. So I wanna make sure that I'm supporting his head and neck so that he's in the best position. So I'm gonna go ahead and just put some towels underneath his head. Just so he's in better alignment, he's able to lengthen out through that back side of his head. Now, Dr. Osar is the cleaner upper of our house, and he cleaned up too well for me. Coming back. So if you have clients who are older and they're really stuck in this position, you need a bigger support so that they're in a good position. And this is something you already have in your gyms, and Eric's pad works really well for that. It's soft, and then that way you can build it up a little bit easier. Now, so I put him in his good position, and we also want them the best neutral position that they can be in. They should never experience discomfort when they're doing this. That's key. They should never say my back hurts while I'm doing this. I'm really uncomfortable. They shouldn't feel a need to get comfortable while you're trying to teach them how to do breathing. So This is a position to teach this in. You can teach somebody breathing on their stomach. If you're working with a pregnant person, you can teach them breathing in a well-supported sideline position. You can teach it in any position. For this, I'm gonna have Dr. Osar bend his knees up so he's in the hook line position. All right, so when we're teaching three-dimensional breathing, remember, the diaphragm is that round, dome-shaped muscle. I need my client's brain to connect to that idea. So we're gonna give them we're gonna teach them through the 3 different dimensions and get their brain to interact with that. And then we're gonna have them put it together. Everything I'm gonna say is gonna be very gentle. Dr. Osar will not say I talk to him that way all the time, but for this I will.
That's true.
All right, you guys. Can everybody see him okay? Good, thumbs up, everybody can see him? Awesome, thank you. All right, so if I'm working one-on-one with somebody, I'm gonna go ahead and put my hands on them with permission. If you work in a place where you can't, it's okay, you're just gonna talk your client through it, because in reality, you want them to do this on their own, and so they need to know how to do it that way. So, I will say, Dr. Osar, I'm gonna have you put your hands just inside your hip bones. So, your ASIS is moving to the middle, and then oftentimes I have them point their fingers down towards their pubic bone. Dr. Osar, put your hands right there. Okay, so I want my client to always breathe in through their nose and out through their nose because it helps warm the air to your body temperature and it helps clean out any debris. If you breathe through your mouth, the debris will go right where you don't want it to go. The nose helps purify the breath as it goes in. So I'm gonna have Dr. Osar actually close his eyes. I'm gonna have him take 3 breaths in, 3 slow, gentle breaths. Dr. Osar, if you could just very gently send your breath to where you feel your hands. Nice and easy. I don't want you to feel like you're pushing your breath into that space. Now this is not belly breathing. Belly breathing usually happens around the area of your navel. You can see Dr. Osar showing you guys that. You'll see the belly pooch out, right? That's not what he's doing. He's sending his breath much lower than his navel. This is his navel. I'm asking him to send his breath all the way down here. So he's gonna take 3 nice, easy breaths. I always want him to fully exhale with each breath. Good. You can see there's a gentle rise in the area of his abdomen, but not this big pooch, not this big balloon-looking shape coming from that space. Awesome job, Dr. Osar. Now, if you have clients who can't easily put their hands on their ribs, you're going to give them a strap. A yoga strap is nice and long, so it wraps around. You're just going to have them gently wrap it around and gently pull on it for a kinesthetic cue. So we did the 1 dimension of the diaphragm, top to bottom, right? Getting the diaphragm to come down and go back up. Now we're going to have him focus on the diaphragm going out laterally or side to side. So I'm going to keep my hands here just to monitor that as he's breathing, it feels nice and gentle. A nice full exhale all the way out. Good. Gently breathing in. Filling those lungs is a nice, easy picture for people to have in their heads as well, because I've seen enough commercials of the lungs. Good, nice job. If you notice, as he's breathing, I'm not seeing this big extension in his spine. I'm not seeing this big, huge expansion of his rib cage, so I'm not having him force the breath. I'm being very particular with my words of where I want that breath to go. And a nice full gentle exhale, let that breath come all the way out. Beautiful. Now, if I'm working one-on-one, I actually put my hands around their diaphragm into the back. Where the belt is about the level of his diaphragm. I can put my hands around here. But for this point, I'm just going to have him to feel the strap on his back and think about gently sending his breath towards the strap on the back. And again, I'm going to monitor just to make sure, if your client is doing this wrong, you'll see them actually start to lift their spine up off the table like he's showing you here. That's too much. You're using too much effort. I would rather they not get their breath into that space than try to push the breath into that space. Only further driving them into probably the area that they compensate through already. Good. One last breath there. Good. So once I've taken them through getting their breath top to bottom, side to side, and front to back, I want them now to see if their brain can put that together into a nice equal breath. So you can have them keep the strap there, because if you had a client who struggles with that posterior breath, getting the breath into the back, or that lateral side to side breath, this is just their nice kinesthetic cue. So I'll say, I want you to feel that breath going nice and low, spreading out side to side and along your back. Nice, full, gentle exhale. Dr. Osar, on your next breath, I'm going to have you breathe in for a 3 count, a pause, and out for a 6 count with a pause at the bottom. Breathing in for 1, 2, 3, pause, exhale for 6, 5, 4, 3, 2, 1. Pause, inhale for 1, 2, 3, pause, exhale for 6, 5, 4, 3, 2, 1, and pause there. The reason I'm having him take a longer exhale than inhale is most people breathe in, but they never fully breathe out. So if they don't breathe out, Dr. Osar is showing you, they start to look like this. It's so amazing to see your client as they fully, you can exhale now, exhale, the ribcage actually starts to relax down because you take them out of that position. I work with this really big burly guy, and the first time I did this breathing with him, he came out and he's like, I feel like I'm like 15 pounds lighter. Because he actually looked slimmer because his body was proportionally back over top of where it was supposed to be. So that's how you can teach 3-dimensional breathing. But one thing we want to have people do is we need to give them a better strategy when they're done with that. Because now we probably, through breathing, just released a whole lot of things for them. So we need to start to give them back a better strategy. So the towel pull part is a nice strategy. So Dr. Osar, bend your elbows, have your palms facing toward each other. And my instructions to him are, I just want you to imagine as though you're pulling this towel apart while you continue to do your 3-dimensional breathing. This is a great exercise if you have clients who have more of that forward shoulder and they're always really tight in that position. It helps them create a better, more open strategy through the front of their shoulders while they maintain their breathing. And it is really cool when clients execute this correctly. You see their shoulder just melt across the table, because you're taking them out of that strategy that they use by teaching them how to breathe differently, and then how to do an activity like this that should require a lot of muscular effort to do. Great job, Dr. Osar. Thank you very much. So that's great. We did our corrective exercise. We taught him how to breathe, but now we need to take this into real life for him. So how many of your clients have to squat for everyday life? If they go to the bathroom, they have to squat. So everybody has to squat in everyday life. So we're going to have Dr. Osar show us how we squat using our breath. So everything starts with alignment. We need to make sure that he's aligning correctly and that he's using his breath correctly. All right. So Dr. Osar, I'm going to have you do your setup. So you want to have a nice long spine, just like what we were doing on the table. Nothing should look different even though he's standing up. I still want him to have his nice long spine. If you remember the picture of those ribs, he's got those intercostals in between those ribs. The ribs should be lower in the front and higher as they wrap around to the back. When your client has this kind of posture, the ribs now go up in the front and down in the back, closing off this back part of the diaphragm. So that's what we start with. Or if you have your client who's more kyphotic, they're squished here, and then the ribs are still doing that same thing. So we're gonna have him come here, his nice long spine from here. We're gonna have him think about suspending or creating space between those ribs. And as he goes into his squat, I'm gonna have him exhale to sit back, to think about letting those glutes relax that he's likely squeezing, and then inhale to come back up. Maintaining his alignment. Exhaling to sit back, maintaining his nice alignment. And then inhale to come back up. Relax there. Dr. Osar, if I'm not a good breather, or my neck is all jacked up, what might I do is I go into my squat. I'm going to go through further extension here, and further extension into my cervical spine. Now, Dr. Osar, come up. What happens if I'm in good alignment, but I still don't have great control of my neck as I go through my squat? This is where they get the movement from. If they don't have enough range of motion, they're going to start to move through their neck. So if you have clients who are like, oh, my neck's always hurts, always jacked up, or you see them and they're always kind of like this, help them with this. Get them in good alignment. It will help with their breathing. You're reinforcing good breathing for them as well. And then only let them go as far as they can, maintaining that. Because now you're giving them the ability to breathe while they're performing the exercise. Nice job, Dr. Osar. Can you guys give him like a little applause? Thank you very much. He needs that. We all need that today, right? Okay, so that's how you can go ahead and teach three-dimensional breathing to your clients. Oh, he just reminded me he wants to be reassessed. Are you ready? Let's see how he does. So Dr. Osar, please face the wall. So we're going to look at his cervical rotation, turning to the right. Nice job. And turning to the left. You guys, what do you think? That's amazing. Can you guys see that? Or do I need to move him closer? What do you guys think? That looked pretty good, right? He looks much more symmetrical. Yep. You get some applause again there, Dr. Osar. Okay, backing him up. Okay. Let's look at your hip rotation, bringing them down so you guys can see. Okay, there we go. Turning to the left, right, left, right. Turning to the left. Not perfect, but better.
Better. Just a little tight on this side, but definitely improved.
Yep. Can you guys see that? Like he was really like just jammed up before, and now like just the quality of the motion looks better, which is something if your clients don't feel a huge range of motion change, if they can feel a quality in the motion, that is huge. Okay, let's look at his shoulder flexion. Okay, and how about the other side?
Both sides feel easier.
Good. Now, you could say that's all smoke and mirrors and he knows exactly what he's supposed to do. And that's a true statement. We're here and you guys don't know exactly what we're doing, so that's cool. But I do want you to try this on yourselves. It's an amazing thing that you can do. It's literally the reason I'm here is because it happened when we were at a big event like this in person. And trust me, I didn't know that lady. She lived in Alaska. I didn't know her till that day. So that's why it's so important to teach your clients breathing, not just, I'm sorry, you guys, I'm looking for my clicker. Oh, Evan took it. Not just because we need to for proper gas exchange. Obviously, that's super important. But how simple was that? That was less than a 5-minute, well, we could be a warm-up you can use with your clients, a simple assessment in your groups. Hey, everybody, let's all get together. Let's do our assessment really quick. And then let's go ahead and, yeah, I talked about that already. Oh, he's trying to tug over me. All right, so what I was saying was, you want to make sure you're doing this. It's quick and easy. Have your clients come together, do their self-assessment, get a sense of how they feel before your session begins. You're only going to show them how much more value you bring to them if you have them assess before the session. Have them do the breathing. They will experience a change. And all the years I've done this, I've only ever had one person who went like this. I don't feel anything. So in all the years of doing this, only ever one person said, I don't feel any different. And that's okay. Not everybody's gonna feel a ton of difference, but here's the thing. A small amount is not insignificant. Because if you have a client who has great range of motion everywhere, but they have this one little area and they don't have great range of motion, and you make that much of a tweak for them, that's huge. That could be all they needed to not have pain, to be able to do something that they wanted to do. So it can be huge. All right, so after we do our corrective exercise, which was our release. So you can use any kind of soft tissue release stuff that you have. And then you're gonna go ahead and do a small corrective exercise, just something to reset the nervous system. Remember, breathing can be very relaxing. And sometimes it can relax areas that they don't really need relaxed, or they don't have a good strategy once it is relaxed. That's why we do a gentle activation. There's other ones you can do as well. That's just a nice, easy one to do. The biggest thing is, less is more. So then we're gonna have them take it into whatever activity they're doing, whatever exercises you're having them do throughout the session, that's how they should be breathing. They should always be thinking about their three-dimensional breathing. It is essential. If you lose alignment, if you lose three-dimensional breathing, you will lose range of motion. Cannot see the entire screen. Thank you for that feedback, I appreciate it. It popped up, there we go. Okay, oh, what did I do? Okay, So some of the cues, remember when you're teaching people breathing, you would never scream at a crying baby. Don't scream at your clients while you're doing breathing with them. Be gentle, be kind. So think about sending your breath into your fingers gently. Imagine your lungs gently expanding while you're doing your breathing. See your breath filling and expanding into your pelvic bowl. See your breath. One of my favorite ones I really like to do is give them a picture of the lungs. Show them these little venules and vessels that are in their lungs and have them imagine that breath expanding into all those spaces. One thing I want you to appreciate, your lungs, if you don't already know this, come all the way up here. The top lobe is all the way up here and they go all the way down to the bottom of your ribs. So that breath has a lot of places it needs to get to. All right, I've got a few minutes, so I'm just gonna say, this is my list of clients, so I thought about the top of my head. My client, Paul, came to me years ago because another massage therapist had referred him to me because he had a scar on his knee, and she swore it was a reason he wasn't getting better. So I started seeing him, and we started working together. And I'm a massage therapist by trade, so that's what I do with a lot of people, but always, now my sessions are half massage, half movement. And Paul was a horrible mover. He couldn't move to save his life, the sweetest man possible. We started working together, and then I said, you know what, you need to work with a trainer who understands, because every time he would come in, he was in pain from his personal trainer. Pain from his personal trainer. So I had him work with a personal trainer that's come through our system. And he would come into me, he's like, I just love the breathing. That's how he kind of talks when he's talking. He's like, I just love the breathing. I love the breathing. And no matter what, he would come back. He's like, Jenice, I was at the country club and I was on the floor in the locker room and people were like looking at me like I was dead or something. I was doing my breathing because as soon as I do my breathing, I get up there and my swing is amazing. I've got so much more motion, and he would get super excited. And so I've seen Paul. What's the best thing? When your clients refer their entire families to you, you know you're doing good work with them. I've seen almost every single person in his family. And so on and off throughout the years, and he started coming back because he's having back pain. And then he started having digestive issues. And his back pain went away, the digestive issues were kind of getting worse. The doctor's like, oh, you know what, you have a hiatal hernia, some gastric reflux, gave him some medicine. He liked the idea of what we were doing together. The doctor didn't want to do surgery. And then Paul emailed me one day, he's like, can you call me right away? I called him. He's like, I'm in so much pain. He's like, he's having a lot of constipation. He's like, I just forced like 4 bowel movements and I'm in so much pain right now. Like his stomach hurts so bad. And I've never heard him sound like that. He's such a happy man. I'm like, have you called your doctor? He's like, yeah, I'm waiting to hear back. I'm like, okay, please call me after you talk to your doctor. I'm like, the only thing I can tell you is just find a comfortable position and just do some gentle breathing. And I didn't hear from him. And so I checked in with him the next day and he's like, I had surgery last night. I'm like, are you okay? He's like, yeah, it's not good. He has stage 4 small intestine cancer. It has obliterated his entire small intestines. He is now on chemo for 46 hours at one time, every other week. But here's the thing. He calls me and he says, give me some breathing. What do I need to do? It's like, I feel like crap. I feel like shit. Please give me some breathing to do. Because that's how much he values the breathing. That's Paul. Each of these clients will come to me and say, I didn't do all the things you wanted me to do this week, but I did my breathing and I felt better. I did my breathing and I felt better. So with that, just know the breathing works. All right, this is what you guys were asking for. This is the book. It's called Breath by James Nestor, The New Science of a Lost Art. It's available on Kindle right now. I think it's like $15 or something like that. I do love it. It's great information. It gives you a lot of perspective on breathing. This guy is pretty awesome. He's done all these different breathing experiments. He's gone and learned from the best people. So it's great. When we talked about that picture I showed you guys from where we saw this picture right here, the diaphragm, the psoas, and the pelvic floor. This is the book written by Dr. Osar a couple years ago, The Psoas Solution, the Practitioner's Guide to Rehab, Corrective Exercise, and Training for Improved Function. There's great stuff in there. There's tons of free exercises online that come with the book if you don't already have it. And then this guy. This guy is my dad. This is my dad about 6 years ago, and this is my dad about 2 years ago. You notice he's missing part of his beard because shortly after this picture was taken, we found out he had breast cancer. And now, many of you know breast cancer is not common in men. Only about 5% of breast cancer cases are men. But not only did he have breast cancer, he had inflammatory breast cancer, which is 1% of 1%. So he had a radical mastectomy on his left side. Before that, he had 4 rounds of chemo that kicked up his diabetes into the 400s, that sent his AFib off the charts. And obviously he lost all of his hair, which is the first time in my life I've ever seen my dad without his beard. But, so now we know he has, because he was a lifelong smoker, I'm not gonna dismiss any of that. He actually told us secretively he stopped smoking without telling any of us that he knew something was wrong, because he started to form a black circle in his lip and he knew something was wrong. So he stopped smoking about 6 months before he found out, before he was diagnosed with breast cancer. But because chemo is not a pleasant experience, and it's meant to kill something, it's not meant to make you better, it's meant to kill what's there. It did. His surgery was a success. He has mild lymph issues because of it. He has the ugliest mastectomy scar of any human being I've ever seen, but he's not a vain man, so it's okay. But I recently said to him, because the doctors wanted to put him on oxygen, because he is so short of breath, he can't even walk to his car without getting short of breath. And I said to him, Dad, I'm teaching this class, and I really want you to practice this breathing with me. And the only thing I asked him to do, because this man, short of playing basketball, I think the last time he exercised was probably high school when he played sports. But he said, sure, I'll do that. And I had him put on his pulse oximeter. I had him get in his recliner, his favorite chair, and align his head the best he could. Pillow behind it. And I said, Dad, I just want you to close your eyes. And I just want you to breathe. I told him, because he watches a lot of TV, I said, just picture those lung commercials. And I said, I just want you to picture that. I just want you to picture just very gently, ever so gently, just putting your breath into your lungs. I want you to take 3 breaths. Just start with 3 breaths. And so he did that, and we stopped, and we did it again. It was probably about 10 breaths, and his O2 went from 89 to 94. Now, my dad hovers in the mid to upper 80s, which is not ideal at all. And he got super excited. He's like, well, that was easy. And so I said to him, I'm like, I want you, for the next several weeks, I want you to put your pulse oximeter on, get in your lounge chair every hour, and I just want you to take 5 breaths. And over the few weeks, I said, okay, now I want you to breathe in for a count of 3, and I want you to exhale for a count of 5. He's gotten to a point, even without the oxygen that he's now supposed to be on, that he's staying in the 90s. His O2 is staying in the 90s, and it's getting better when he takes his breaths. Now, I asked him the other day, because he sent me his O2 stats, and before his breaths, they were 92, and after they were 96. And I said, oh, he's like, this is me going up and down the stairs 2 times today, which is never an easy task for him either, because he's gotten to the point where his oxygen distribution is so bad that his legs get weak when he does too much. And so I said to him, I'm like, hey, how did your legs feel? Because that was kind of going to be our big test. Like, you can make some of these O2 stats go better if they're breathing better. And he said, they were still weak, but they definitely felt better. So I think that's a huge gain. That's a huge win. That's quality of life for him. And I said, the next thing I want you to be able to do is I want you to be able to, my parents live out in the country, so their driveway is pretty long. I'm like, I want you to be able to walk out to the end of the driveway and back and not feel like you have to go really slow to do it. and feel like you're not losing your breath while you're doing that. So we're making small goals, but exponentially huge things for his quality of life. And the gentleman that I referred to earlier that was saying how breathing is not a common thing, or the knowledge of it is not common, he actually worked in a hospital with people with emphysema and COPD, and he's not a doctor, he was a music instructor. And he talked about how when you would go to watch him, he would be working on people's ribs and working on their necks and, you know, adjusting their ribs. And if you came into our clinic any day with any of our practitioners, that's pretty much what it would look like. We'd be working on people's necks, we'd be working on their rib cages, we'd be opening up their backs, and then we'd be teaching them how to breathe. So working with your family is never ideal, but I think this one's worth it. So that's my dad. But I love this because it says that all chronic pains and suffering and disease are caused by lack of oxygen at the cell level. People always ask Evan and I why we never get sick, because we travel a lot and we work stupid hours and we probably should take better care of ourselves. And I would say it is 100% related to the fact that we live by this. We live by doing this. So here's my final thought for you. Breath is the finest gift of nature. Be grateful for this wonderful gift. Thank you. You guys, thank you. If you want to learn more about anything that we do, you can always reach out to me. This is our website. We have amazing programs. Obviously, I'm 1000% biased, but we have great people that we work with. So, guys, I'm so over your time. And I know you have other places to be because Evan has to be on a session. So I want to thank you so much. If you have any questions, please reach out to my email. I'm happy to answer them. I'll just quickly scroll through.
Yeah, there was a couple. They wanted some clarification on the breathing during squat. Should they exhale on the way down or the way up?
Yeah, so this one's always a confusing one. That's why Amanda's laughing. We like this. We call it a corrective breath because it's part of your corrective exercise. When you think about exhaling, you think about letting things relax. If you have a client who is a butt gripper, whose hips are always tight, if you think about having them exhale, you will find that they will start to let that pelvic floor relax and start to create space. Because remember, we're trying to activate those spinal stabilizers and those hip stabilizers. And those hip stabilizers, if this is their hip joint, actually help bring the femur into the socket so that they can move more freely. That's its job. So that's why we use that reverse breathing. And I will tell you, one of our IMS people who's been with us since the dawn of our company's birth, she came in for a private session late last year. And she's like, wait, why am I breathing like that again? And so I did it with her and she was like, oh my God, I can't. She's like, my squats don't hurt right now. She's like, I have zero knee pain while I do it that way. So it helps. So many people are so gripped up in exercise that you're helping them change the pattern of how they move through a squat. If you're having people lift high amounts of weight, you're gonna wanna go back to the regular breathing of inhaling to go down because it helps give them more of that stability if you're doing heavy amounts of weight.
Any thoughts on working with people wearing masks and breathing?
That's an excellent question. I'm so sorry. I got a little carried away. Yes. So this is our plan for working with our clients who have to currently wear masks, is we teach them the mechanics of breathing in their session so that they understand it. Maybe 3 breaths max, because you obviously don't want people sucking in their CO2 and the crappy air that's stuck in the mask. But then what we'll do is we'll do a follow-up session with them over Zoom, talking them through it, whatever's best for them. If you have older people, they're not into Zoom, we'll just maybe do a phone call with them and then just take them through it where they can actually practice it. But maybe do the self-assessment so they can feel the difference. Yep.
You think proper breathing could help people with chemo-caused constipation?
That's a tough one. I think that anything you can do to help mobilize the organs is going to help. Absolutely.
Yeah. Any suggestions for working with really short clients that are stuck in thoracic extension because they're looking up at everybody every day trying to get taller?
Absolutely. Absolutely. Remember, if they're stuck in thoracic extension, well, lots of times it's going to be thoracolumbar extension, so a little bit lower, that a TL junction. Think about helping them release their erectors. We didn't show you the Roga in this session, but that's why we like the Roga, because it has the grooves where you can actually put the spine in the grooves, and then the humps of the Roga actually help work the erectors. So helping them relax the erectors, oftentimes maybe even the lats as well, and then teach them how to breathe. Obviously, they probably need some posterior breath work. Anything else in there, Amanda?
If I missed something, go ahead and just question it now.
Wendy's asking, is there any time you use exhalation from the mouth?
Yes.
Pursed breathing is an option for people. One thing you want to tell people though, and that a lot of respiratory therapists will use pursed lip breathing for a lot of people, you want to make sure they're not bearing down through that breath. You still want the breath to be light and easy and controlled. You just want to make sure they're not breathing out like that through pursed breathing. Yep.
Several weeks away from total hip replacement. Anything breathing I can do for prehab and post-op?
Yep, absolutely. Yep. I'm not really sure what type of hip replacement you're having, if you're having a posterior and anterior hip replacement. Either way, your hip complex is going to change related to that surgery. What we did here will be priceless for you, because remember when we looked at that psoas, the psoas is one of it's going to be what helps centrate your hip in the socket. And breathing, remember you got that myofascial connection from your diaphragm to your psoas to your pelvic floor. So it's priceless for doing that.
Yeah, I'm having trouble with my chat, so if there's something else.
Really short clients. Does anybody else have any other questions really quick while I'm on here? And if not, you can always send them if they come to you later. See, how many breaths or time do you spend doing this? That's a great question. Hope you don't mind. I'm not going to say your name, but it's a great question. So I'm going to answer it for everyone because it's a common question. When you're working on breathing, oftentimes your clients have never or have not breathed like this for a really long time. So 3 breaths to start, making sure that they're getting that full exhale. People will feel a little bit dizzy when they come up from this type of work. And then lots of times we'll have clients do 5 to 8 breaths. It just depends. Everybody's a little bit different, but never send them home with breathing that they're not having success with. So if you were trying to teach them 3-dimensional breathing and they did not have success getting that breath into the posterior aspect of their diaphragm, don't send them home with that. Send them home with the lateral breathing and the top to bottom breathing, because that's where they had success. If you have them try to do that posterior breathing, they didn't have success with you, they're definitely not going to have success with themselves. And remember, those clients who can't get that breath in the back, to get that breath in the back, they do this. They compensate to do that. Okay? And you can see that when you're having your clients do it, they'll literally breathe. Remember, one way you can also assess breathing is by just having people breathe. What do they do? How do they breathe when they're lying on the table? It's a great place to just look at it. And you guys, I'm so sorry. We showed this in a lying down position. If you're working in a group setting and people can't lie down, this can easily be done in chairs. Everything is the same. Just have them sit in their best posture with their best alignment.
Against a wall work?
I'm sorry?
Would against a wall work?
It can if you're worried about them balancing and standing. I will say I have a client I've been working with for years, and her thing is Jenice, I try to do this at work and it's so hard I can't do it in standing. Yeah, it's going to be harder. You're fighting against gravity, so it's going to be harder. All right, you guys, thank you so much. I know everybody else got to get to their next session. Thank you. I love you. If you have any questions, please let me know.